So bad watching that. I'm glad you're okay.
Just gotta ignore it.
Our HEB is pretty friendly too. It's usually not like that.
Sure.
Hey, I thought I came from the tough side of town, south side. I'm going back.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by our local public health authority, Dr. Junda Wu, and this is our COVID-19 update for the San Antonio community. This week we have a little bit of good news to share. That is, our positivity rate has now dropped to 7.6%, which is following drops in the previous couple of weeks. Consistent with more testing we are seeing in our community, that positivity rate is, again, good news and going in the right direction. Our case rate has also dropped to 51.2 cases per 100,000. However, our health system score has remained in the upper end of the high stress score after 4 consecutive weeks at the severe risk level. We're seeing some improvements in our indicators, so our overall risk level has now been modified to moderate. This does not mean we're out of the woods by any means, and it does mean that wearing masks, regardless of your vaccination status, as well as getting vaccinated if you haven't, will help us contain the spread of the virus. In talking with our hospitals and our STRAC director today, they are still under severe stress, which is a concern for everyone in our community, regardless of their COVID status. So let's keep continuing to do our part. Today we are reporting 1,288 new cases of COVID-19. Our 7-day moving average is now 1,222. That number again represents the average daily case rate over the last 7 days. Thankfully, we do have no new deaths to report this evening, but we've lost now nearly 4,000 of our friends and neighbors and family members to this disease, so please continue to keep their family and friends in your prayers tonight. There are 1,215 patients in local area hospitals and 176 new admissions in the last 24 hours. 359 patients are in the ICU with COVID-19 and 243 are on ventilators. So still quite high in those numbers. 83% of patients in area hospitals are again unvaccinated. 19 patients tonight in local hospitals with COVID-19 are children. Let me turn it over now to Judge Wolff.
Well, a lot of the numbers are moving in the right direction, but the thing that's still perplexing to me, though, is seeing how many new people are going into the hospital every day. We were hitting, I think, a high, maybe 190 something, but we're still shooting 172, 162, jumped up to 176. So there, a lot of people are going in the hospital, but obviously moving out fairly quick. But still, 1,216, that's only a couple of hundred or so below our very high. So there's still some real concerns about what's happening there and how we can turn it around. So like you say, this is no time to let up and to be careful about what we're doing. The schools are still a little perplexing to me also. I know that they're self-reporting every week, and the last numbers I had, we started out on August 18th, it was 1,273, then jumped to 5,167, then jumped to 18,111, and then to 27,033 each week, which is a total over 51,904 COVID cases in schools on self-reporting. And I think we'll have probably some new numbers for the last week, maybe by the end of this week. So we're trying to keep a close eye on schools, and we want to thank all of the school districts that have stood up and say, you got to wear a mask. It's protecting our children. Everything that we're doing here in our efforts is to protect children. That's why we filed the lawsuit. That's why we know from all previous experience that the masks, the social distances, the sanitation protects us. And so, again, thanks to the school districts that are really stepping up and making this happen and protecting the children in their district.
All right, thank you, Judge. And just as we are beginning to gain some control again of this virus, we ask you to continue to do your part because it is making a difference, and we are starting to see that now in the numbers. But please do not let up. Again, our hospitals continue to be overloaded. Our medical system is at full stress, so we need to continue to do our part. Before we go to questions now, I'm going to turn it over to Dr. Junda Wu, who's going to talk to us a little bit about some of the myths and dispelling those myths about the vaccine and long-term impacts from the vaccine. Dr. Wu?
Hi. I know there are some people out there who are waiting to see if the vaccine is safe over time. I've heard people say after a year, sometimes people say after several years. And I think that comes from our experience with some medications, right? In fact, there's an axiom about never being the first or the last doctor to prescribe a brand new medication when it comes on the market. But I want people to think about how medications are things that you take every day, at least once a day, and it gets in your system. The vaccine goes in you once and it's gone. Some people have described it as being like a Snapchat. When we look at the vaccines that are on the market right now, even the bad adverse outcomes we know about usually within weeks, certainly within 6 weeks. So the vaccines, the trials for some of the mRNA vaccines started in March 2020, well more than a year ago. We definitely have more than 6 months of data on all of them, and I hope that's reassuring to some people.
Great. Thank you, Dr. Wu. And again, thank you to everyone who's continuing to do their part to control this virus, continue to mask up. Get vaccinated if you haven't yet. And if you want to find a testing location, you can visit covid19.sanantonio.gov or call 311 and hit option 8. And again, a reminder, we are continuing to see surges in our hospitals, and that is a concern for everyone who depends on our medical system, even on their worst day. So please wear a mask and get vaccinated if you haven't. Do it for yourself, do it for your family, and do it for San Antonio. And you can get the latest on COVID-19 by going to the website covid19.sanantonio.gov or by texting COSAGov to 55000. With that, the judge, myself, and Dr. Wu are available for questions.
Hey, Dr. Does that work? Dr. Wu, quick question about what's been coming out lately about the MU variant, the MU variant. I was wondering if you could tell us a little bit about that and any other variants you've seen come through our county.
The Mu variant is now in the United States in, I think, all the states except Nebraska, the last time I checked, but it's a very, very small proportion. It's not even 1%. There is some concern that it might be more liable to break past vaccinations, but we still don't know. So it's something that the CDC is monitoring.
Dr. Wu, how many COVID testing sites are currently open, and will there be any more offered considering the surge in cases?
So of the free sites, there are 13 the last time I checked. I didn't go back to the website and count today, but it's more than a dozen. And I've personally visited the sites, at least 5 of the sites in the last 2 weeks because I've been concerned about whether we have enough capacity. And I've seen the line was never more than 10 people. They are pulling people through at about one person every 2 to 3 minutes. So it seems like the capacity is okay. I will say it's a little bit tighter now. Like it's hard to get, I don't think it's possible to get a same day appointment these days. I think it's going to be the next day. So just plan ahead a little, but it's not to the point where we feel like right now we need to add another site.
Dr. Wu, you had mentioned that new variant is within just about every state. Have we seen it sequenced within here in Bexar County?
I don't have that information.
Are y'all expecting another surge of COVID cases, and will the city and hospitals and county take additional steps to prepare?
Well, I mean, I can give you our impression again. After every holiday break, we seem to have additional activity, more interaction with people, which means more likelihood of transmission. So we have to anticipate a surge in cases. If we don't get that, and people have again been extra vigilant, we'll be grateful. But we have to anticipate, some additional cases as a result of the holiday weekend. At least caution would advise.
With nurses, I think they're bringing in, I think we've got a total of 793 have been deployed, maybe 80 more coming. So the hospitals are getting ready if we do have uptick after the holidays.
Can you all talk about the supplemental nurses that we received? I think, Judge, you said it was about just under 800 or so.
Mm-hmm.
How is that helping the already overburdened and overworked hospital staff?
Well, let me tell you, it's difficult for them. I think you may have remembered we had one of the head nurses on here from the Methodists, 2-3 weeks ago, and she talked about how unruly and how nasty a lot of the unvaccinated people were that came into the hospital and how they had increased security. So it's not only, dealing with the sickness itself and the hazard to you, it's also some of the way that some of these people are acting. Not all of them, but some of them are. And if you look, and it's hard to get the right, correct numbers because we have a diversified healthcare system and numbers are reported, but I think last year over 900 was reported dead healthcare workers because of handling the COVID cases. other ones, some of the nurse associations say it's more like 1,500. So we also know that they're risking their lives out there. So not only is the unvaccinated person hurting themselves, hurting their family, they're making it very, very difficult for healthcare workers, and we're losing a lot of them because of the fact that people are just not being careful.
Hey, Judge, would you like to comment on the letter that the sheriff just released about the budget proposal involving 12 of his deputies being reallocated to different constable positions?
Well, we did have 12 people that were working in the sheriff's office that handled warrants, and so were a lot of the constables were having that. So when we looked at the fact that why don't we consolidate them, the debate was, should we consolidate them with the constables or with the sheriff's office, and the decision was made to move those 12 positions over to the constables.
I know in his letter he mentioned that they do more than just hand out warrants, including looking in certain crime areas and their investigations. Do you think that's going to hinder anything with their operations?
Well, they're budgeted for warrant. I don't know what he's doing with them. He may have used them for some other services, but I think that the constables would be also in the same position of being able to do it.
Mayor and Judge, are there any concerns about local schools closing because of the high case counts and employees needing to quarantine?
I mean, that's one of the primary concerns that we have in terms of the mask mandate and not having the proper mitigation protocols in schools, as if they can't have the required number of staff due to quarantine or too many students are out, they wouldn't be able to conduct class at all. And when that begins to happen, you have a cascading impact on pretty much every business in this community and the economy overall. So, this whole characterization of let's open up, forget the mask mandates, we don't need to have these kinds of things going on in schools, that belies the reality. Is if we don't have effective, safe school openings, our entire economy will begin to collapse.
Are you aware of any schools that have reported major outbreaks to y'all, or that have had to do any sort of closures?
Go ahead, Jim.
No, I was just saying there's schools that are in other parts of the state that have closed. I know there was one district by Waco where they closed, they had 2,700 kids that they had to close the schools on.
And Dr. Wu, you want to talk a little bit about the data that we're going to be posting that will help answer some of these questions?
There have been some outbreaks, but none that have resulted in closures. So we are going to be trying to post some data that's complementary to what's already on the state's website. So for those who don't know, you can look up not only by district but by school information on the DSHS website. So if for one thing, we'll include a link I hope that'll make it easier to just hop through to that website, and then we'll also have some pediatric data, which I'm not the person who's putting that together, so I don't want to speak for them, but some kind of pediatric data to help provide a little bit more context as well.
On that note, I was just going to ask, do you guys have the total number of pediatric cases, not just in the hospital, but in total?
We do. It's in the monthly epidemiology report that comes out. So that came out a few weeks ago for July. It's always 1 month behind because it takes so long to clean the data and make it be accurate. But you can find that. It's I want to say, no, I don't want. I was going to give you a percentage, but I don't want to get it wrong. But you can find it in there.
Is it accurate to say there's been an increase in the number of children with cases now that school's been back in session for a few weeks?
Yes.
Can you tell the children who might carry some sort of guilt for possibly carrying COVID home how they should feel about their situation?
Oh.
First of all, I don't think it's the child's fault. would be the fault of the schools not doing the right thing to protect them. And if they got it at school and took it home, I don't think it's the child's fault at all.
Do we have a number of, even though, speaking on the pediatric cases, whatever that total may be that you said we can find somewhere, do we know how many of them recovered?
The vast majority. So I hope that's reassuring for parents.
And with the vast majority of them recovering, do we have any specifics as far as the symptoms these babies were feeling, as they were dealing with COVID?
It's, cold-like symptoms, the same kinds of COVID symptoms that we've been talking about, and then children might be a little bit more likely to have tummy symptoms as well, so maybe some nausea or diarrhea. But that's not very specific, which makes things harder. And there are a lot of viruses going around right now.
Hey.
Judge, can you please talk about, earlier you talked about unruly, unvaccinated patients were being in the hospital, and you had an encounter this past weekend at HEB. Can you talk about whether you will increase security or if you felt in danger during that encounter?
Well, no, not increasing security. I'm going to continue to go to the grocery store by myself and live a normal life and not, feel intimidated or be scared by some of the things that people say.
Judge, have you had any further thoughts about that incident? You had a similar one. I think it was last year now. Have you had any further thoughts about, I guess, people coming up to you and talking and speaking this way to you?
Well, I think there is a lot of hatred and anger out there. All you need to do is go on social media and see how it's all spewed out. If you took a poll of Americans, some 15% believe in QAnon, which says we're all devil worshippers. In fact, that was one of her comments that she made to me was, how could I support the devil? So there's a lot of, terrible things on the internet and so much misinformation. Like she said, that the vaccine was a bioweapon and that masks are not helpful. And so people pick this up and they pick up those terrible things over the internet and then they espouse the same views that they pick up.
Well, and I'll just say, people who choose to act in that manner, if it's not corrected, if people don't call it out, we just continue to permit incivil behavior. And that is as big a disease in our community right now, in our nation, as anything else, just the incivility that we're seeing. So it's a problem.
Hey, Judge, one more question. Back on the budget proposal, just so I, just get the clear facts together. In his letter specifically, he says that some of the people that were being rearranged were coming from his SWAT team and the Criminal Investigation Division, which target specific organizations. Is that something that you think?
Well, first of all, I think it's important to point out there's 140 or so vacant positions in the sheriff's office right now. That have been there for quite some time. They're budgeted, they're funded, so he can fill any one of those positions with the officers, the 12 officers. So if there was not a place for them to go, and if he didn't have the money, he has the money, he has the positions that have not been filled, so he has the flexibility to use them.
His argument is that if he doesn't have the people already, it's hard to try to get those positions filled, and it seems like more people are getting taken from his, his division. What would you say to that?
Well, like I say, there's 140 or so unfilled positions that are budgeted and funded And so there's 12 people, and there's, I think, plenty of room to place them.
Dr. Wu, on Monday, Dr. Fauci said that the Moderna COVID booster vaccine won't be approved by September 20th as President Biden had hoped for. What message do you have for immunocompromised people who got the first 2 doses of Moderna and are thinking about getting a Pfizer booster? Would that be okay, or should they wait?
Thank you for giving me the chance to clarify. There's a lot of confusion right now about boosters and then what's called additional doses, which sounds confusing. The additional doses for people who are immune compromised, so that means you need 3 doses just to get where most people would be with 2 because you're immune compromised. Those are already approved, so you can get them, and people have been getting them from their providers. Usually the hospitals or the doctor's offices have been reaching out because these are people with moderate to severe immune problems, so they're under continuous medical care even now. So we're not talking about, say, diabetes. We're talking about, cancer on chemotherapy, organ transplant, dialysis, more serious conditions like that. So from what we can tell, people have been getting those additional doses. Separately, there's the question of boosters, and that's for possibly the general public, and the CDC and FDA are still evaluating that. There's still some debate in the scientific community because we know that the vaccines are still highly effective against hospitalization and death. There does seem to be a drop-off in effectiveness against just infection. So the debate is, all right, then at what point would the boosters be rolled out?
And one more time, where can we find the pediatric numbers again?
If you go to the dashboard, there's a place where you can look for, there's a button for more data, and when you go there, there's a category called Monthly Epidemiological Report.
You said all that's going to be kind of a month behind.
It is.
Okay.
That's all we have tonight. Thank you.